I want to share with you today a really exciting Canadian story in terms of one of the many things that Canadians are doing to really put their best foot forward and fight the COVID-19 pandemic. And that's an isotope called cobalt-60. Cobalt-60 is an isotope that is produced in our nuclear reactors at the Bruce B nuclear generating station located in rural southwestern Ontario and the Pickering nuclear generating station based east of Toronto. The primary use of cobalt-60 is in the sterilization of single-use medical equipment in a lot of frontline healthcare applications. If we think of gloves that are used that are required to be clean and sterile, cobalt-60 is used to sterilize gloves and a range of other medical equipment. You can look around a doctor's office, you can look in a long-term care facility, you can look in a hospital operating room, anywhere that is really treating patients, and you'll see the presence of cobalt-60 everywhere through clean, single-use medical equipment. And just to put it in perspective, just shortly after COVID-19 was declared a global pandemic, Bruce Power announced the completion of one of its cobalt harvests. One cobalt harvest from Bruce Power produced enough cobalt-60 to sterilize 13 billion pairs of surgical gloves. So cobalt-60 has proven to be a tremendously important tool in the fight against COVID-19. It's something that Canada is doing, that we are leading in as a country, and that reliable supply of cobalt-60 from our nuclear reactors here in Ontario through the supply chain in Nordion are going to be more important than ever. The other area I want to talk about related to the supply chain of isotopes is a new initiative launched between the Nuclear Innovation Institute and the Canadian Nuclear Isotope Council. It's an initiative that's been launched to really look at our overall supply chain for isotopes. The one thing that's unique about isotopes is they only have a certain half-life, which means they're only effective in their use for a limited period of time. But the Nuclear Innovation Institute and the Canadian Nuclear Isotope Council, we're launching a study that is going to look at the robustness of the isotope supply chain and also look at some of the lessons learned from COVID-19 and determine how can we work with policymakers at the national and international level to ensure that we have a policy and regulatory framework that continues to ensure we can produce and manufacture and distribute isotopes, because when it comes to patients and when it comes to frontline uses for these life-saving isotopes, it's really important that we have robust supply chains that we can count on even in the most difficult of times.